Microdosing has gained popularity in recent years as a potential way to improve mental health and well-being. This practice involves taking very small doses of substances, such as psychedelics, to achieve subtle yet beneficial effects without experiencing full-blown hallucinogenic trips. In this video, we'll explore how microdosing might help with anxiety, examine current trends, and review the latest research on this intriguing topic. 1. What is microdosing? Microdosing typically involves taking about 1/10 to 1/20th of a standard dose of a psychedelic substance. Common substances used for microdosing include LSD, lysergic acid diethylamide, and psilocybin, found in magic mushrooms. These small doses are usually taken every few days over a period of weeks or months. Why people microdose? To enhance creativity and focus, to improve mood and reduce anxiety, to boost overall mental clarity and productivity. How microdosing works. While the exact mechanisms are still being studied, it's believed that microdosing can positively affect brain function by promoting neuroplasticity and modulating neurotransmitter activity. Additional substances. Mescaline, found in peyote and San Pedro cacti, used for its mood-enhancing properties. DMT, found in ayahuasca, known for its potential to promote spiritual insights and emotional healing. 2. The connection between microdosing and anxiety relief. Many people who microdose report feeling more relaxed, less anxious, and better able to handle stress. Here are some potential reasons why. 1. Neurotransmitter regulation. Microdosing may help balance neurotransmitters like serotonin and dopamine, which play crucial roles in regulating mood and anxiety. 2. Neuroplasticity. Psychedelics can promote neuroplasticity, the brain's ability to reorganize itself by forming new neural connections. This can lead to improved emotional resilience and reduced anxiety. 3. Mindfulness and presence. Users often report increased mindfulness and a greater sense of presence, which can help reduce anxiety by promoting a calmer, more centered mindset. Personal stories. Emily's experience. Emily, a graphic designer, started microdosing to manage her anxiety. She found that it helped her feel more grounded and less overwhelmed by daily stressors. John's journey. John, a software engineer, used microdosing to enhance his focus at work and noticed a significant reduction in his anxiety levels over time. Additional benefits. Emotional stability. Regular microdosing can lead to more stable moods and fewer emotional fluctuations. Enhanced creativity. Many users report heightened creativity and problem-solving abilities, which can indirectly reduce anxiety by improving work performance and satisfaction. 3. Current trends in microdosing. Microdosing has become a popular trend, particularly in creative and tech communities. Here's a look at some of the latest trends. 1. Silicon Valley. Many tech professionals in Silicon Valley use microdosing to boost creativity and productivity while managing stress and anxiety. 2. Creative industries. Artists, writers, and musicians often turn to microdosing to enhance their creative processes and reduce performance anxiety. 3. Self-improvement communities. Microdosing is increasingly popular among those interested in self-improvement and biohacking, as they seek ways to optimize their mental and emotional well-being. Microdosing protocols. The Fadiman Protocol. Named after psychologist James Fadiman, this protocol involves taking a microdose every 3 days. The Stamets Stack. Developed by mycologist Paul Stamets, this approach combines psilocybin with niacin and lion's mane mushroom for enhanced cognitive benefits. Additional trends. Corporate wellness programs. Some companies are exploring the potential of microdosing as part of their wellness initiatives. Online communities. Platforms like Reddit and specialized forums have vibrant communities sharing their microdosing experiences and tips. 4. Research on microdosing and anxiety. The research on microdosing is still in its early stages, but there are some promising findings. 1. Improved mental health. Preliminary studies suggest that microdosing can lead to improvements in mood, reduced anxiety, and better overall mental health. 2. Cognitive benefits. Some research indicates that microdosing can enhance cognitive functions such as creativity, focus, and problem-solving skills. 3. Safety and tolerability. Early studies suggest that microdosing is generally well tolerated with minimal adverse effects, although more research is needed to confirm its long-term safety. Notable studies. Beckley Foundation conducted research on the effects of microdosing psychedelics on creativity and well-being. Imperial College London, studying the impact of microdosing on mental health, with a focus on anxiety and depression, challenges and limitations. Placebo effect. Some studies suggest that the benefits of microdosing may be partly due to the placebo effect. Lack of standardization. Variability in dosages and protocols makes it challenging to draw definitive conclusions. Future research directions. Large-scale clinical trials needed to establish the efficacy and safety of microdosing for anxiety and other mental health conditions. Comparative studies. Research comparing microdosing to other treatments, such as traditional medications and therapies. 5. How to safely experiment with microdosing. If you're considering microdosing to manage anxiety, it's crucial to approach it safely and responsibly. Here are some guidelines. 1. Start low and go slow. Begin with a very low dose to gauge your body's response and gradually adjust as needed. 2. Keep a journal. Document your experiences, noting any changes in mood, anxiety levels, and overall well-being. 3. Consult a professional. Seek advice from a healthcare professional, especially if you have pre-existing mental health conditions or are taking medication. 4. Legal considerations. Be aware of the legal status of psychedelics in your area. Microdosing substances like LSD and psilocybin is illegal in many places. Example routine. Day 1. Take a microdose in the morning and monitor your response throughout the day. Day 2. No dose, but continue to observe any lingering effects. Day 3. No dose, focus on reflection and journaling. Day 4. Take another microdose and repeat the cycle. Additional tips. Mindset and setting. Ensure you are in a positive mindset and a safe, comfortable environment when microdosing. Support system. Consider having a trusted friend or family member aware of your microdosing experiment to offer support if needed. 6. The future of microdosing and anxiety treatment. The interest in microdosing as a potential treatment for anxiety and other mental health conditions is growing. Here are some future directions. 1. Clinical trials. Ongoing and future clinical trials will provide more robust data on the efficacy and safety of microdosing for anxiety. 2. Integration into therapy. There is potential for integrating microdosing into existing therapeutic frameworks, such as cognitive behavioral therapy, CBT, and mindfulness-based stress reduction, MBSR. 3. Policy changes. As research progresses, there may be shifts in the legal landscape, potentially leading to more regulated and safer access to microdosing substances. Potential developments. Pharmaceutical microdosing. Development of standardized microdosing medications with known dosages and safety profiles. Educational resources. Increased availability of educational materials and professional guidance on microdosing practices. Emerging trends. Corporate interest. Companies might incorporate microdosing into wellness programs if future research supports its benefits. Global perspectives. Exploring how different cultures and regions approach microdosing and its integration into mental health care. 7. Addressing the controversy and ethical considerations. Microdosing is not without its controversies and ethical considerations. 1. Scientific skepticism. Some scientists are skeptical about the benefits of microdosing, citing the need for more rigorous research. 2. Ethical concerns. The use of psychedelics raises ethical questions, particularly regarding accessibility and potential misuse. 3. Informed consent. Ensuring that individuals have access to accurate information and understand the risks before starting microdosing is essential. Balancing perspectives. Proponents' views. Advocates highlight the potential mental health benefits and personal empowerment. Critics' views. Critics emphasize the need for caution, regulation, and more scientific validation. Fifth, ICLE guidelines. Transparency. Encourage open dialogue about the benefits and risks of microdosing. Support networks. Create support networks for individuals who choose to microdose, providing guidance and community. Legal and social implications. Decriminalization. Advocacy for decriminalizing psychedelics to allow for safer use and more comprehensive research. Access and equity. Ensuring equitable access to microdosing therapies and preventing exploitation or commercialization. Microdosing holds promise as a potential tool for managing anxiety, but it's important to approach it with caution and awareness. By understanding the science, staying informed about the latest research, and prioritizing safety, you can explore whether microdosing might be a helpful addition to your mental health toolkit. Thank you for watching. If you found this video helpful, please like, comment, and subscribe for more content on mental health and wellness. Stay informed and take care.